Well, good afternoon, everyone, and welcome back to our daily briefing. And to the Muslim community here in the state of Illinois, Ramadan Mubarak. From my family to yours, I want to offer our best wishes as you begin your recognition of this holy month. Despite the crisis that we're living through, the spiritual strength and charity represented by this month are especially inspirational in these trying times. Today's update is focused on testing. Vital to our efforts to reduce social restrictions, get our economy going, and keep the residents of our state safe is the expansion of testing for COVID-19 infections. Today, I'm proud to be joined by Gabrielle Cummings, president of North Shore University Health System Highland Park Hospital, which has become an important partner in expanding testing in Illinois. Because of partners like North Shore, we are making progress toward increased testing across the board. Last week, when we focused our conversation on testing, we had tested 5,660 people in the preceding 24 hours. On Wednesday and yesterday, we surpassed 9,000 tests. Today, we met our goal of 10,000 daily tests. In fact, we surpassed it with 16,124. The overall positive rate for today's batch of tests is about 17%, which is well below our cumulative average of 21%. It's too early to say whether this is a result of expanded testing criteria versus an indicator of flattening the curve. But it's a positive sign nonetheless for everyone when more people are getting tested and there is a lower ratio of positives. Surpassing 10,000 tests is a very important milestone, not only because it allows us to isolate more of those who are COVID positive so that they don't spread the infection, but also because it moves us in the direction of expanding our surveillance for outbreaks. More testing means we can potentially lower the infection rate, so we're going to continue to push that number up. Our ability to test and get results quickly is key to our ability to map the presence of this virus and to gradually reduce our mitigation measures and get more people back to work. In the face of this virus, testing is really key to everything else that we need to do to get Illinois moving again. There's still more work to do to maintain and build on this progress, but reaching and surpassing the 10,000 mark is a great first step. I think it's important for everyone to know how we arrived at this marker. Getting to this level of testing has been a multifaceted effort, requiring us to circumvent traditional supply chains, stand up non-traditional testing sites, and work with Illinois' world-class healthcare institutions and research universities. For example, university partners such as Illinois Tech and Southern Illinois University at Carbondale and the University of Illinois at Chicago and the University of Illinois Urbana-Champaign are playing a key role in developing VTM and assisting with the procurement of swabs. Those supplies have allowed our state labs to more than double our daily output in the last week, and we anticipate being able to push that number higher in the coming days and weeks. That's for just our state-owned labs. We're also partnered with hospital and commercial labs where we provide supplies, and they've agreed to run more specimens to deliver more test results. Rounding out the components necessary to do more testing, we needed to collect more specimens. So we partnered with local health clinics across the state, like the federally qualified health centers, which already are trusted in their communities. They've helped us expand the number of locations taking specimens for testing, including our 5 newly created state-run drive-through locations. We now have 112 public testing sites in every one of the IDPH's 11 regions, including 8 sites in the Rockford region, 8 sites in the Peoria region, 4 sites in the Springfield region, 4 in the Edwardsville region, 31 sites in the Marion region, 8 sites in the Champaign region, 22 sites in the city of Chicago, 9 sites in the southwest suburbs, 3 sites in the west suburbs, 5 sites in the northwest suburbs, and 10 sites in the north suburbs. Remember, those are only the sites that are available to the public, and the tests at those locations are entirely free. Beyond those 112 locations, there are healthcare providers that conduct tests for their own existing patients. The full list of public testing sites with hours, testing parameters, and contact information is available on our coronavirus website, coronavirus.illinois.gov. Again, testing at our public sites, which you can find at our coronavirus website, is entirely free. I also want to talk briefly today about antibody tests, which have been in the headlines recently and have created a lot of buzz. So I want to make sure that people have the facts about whether and how these tests are useful. In theory, these tests could be an effective tool. We're craving answers in an uncertain time, and antibody tests offer the potential for more security. But I'm afraid we've seen many of these tests promoted in a way that errs on the side of irresponsible. To be clear, these tests are not quite where we need them to be to offer a true metric of immunity in Illinois. This is not an Illinois-specific problem. As of today, there still are no antibody blood tests certifiably proven to accurately and consistently diagnose COVID-19 antibodies. There are several reasons for that. First, no one yet knows the true sensitivity and specificity of these tests. That is, how accurate or inaccurate they are. Obviously, you want a test to be accurate and not offer many false positives or false negatives. That kind of accuracy is in part tied to how long it's been since a person potentially had the virus, since it takes each of us time to produce antibodies, and it's in part tied to the quality of the test. Second, this is a novel virus, entirely new. So researchers don't yet know the extent to which having COVID-19 antibodies equals having immunity. That's a question whose answers will only be revealed over weeks or months and maybe even years. For example, is there a certain exposure level at which antibodies don't protect you? Or if you can become immune, how long would immunity last? Third, it's not yet confirmed that these tests are able to explicitly identify COVID-19 antibodies versus coronaviruses that cause things like the common cold. The tests must definitively identify antibodies for COVID-19 and nothing else for them to be fully effective. Understanding the presence of antibodies and immunity in our communities would be extremely important to our COVID-19 response. So don't take these facts to mean anything else. I just want to be sure that we all understand where the research is right now on the development of tests for antibodies. There are active validation studies for antibodies tests across the nation and the world, as well as here in Illinois. We're monitoring those studies and we're planning how we could deploy those tests when they're ready. As soon as they prove themselves accurate and reliable, I will make it a priority to get them into our communities as widely as we can. What I won't do is run full speed ahead with these tests before they're proven, because, among other things, we would be offering people a false sense of security. I've said since the beginning that here in Illinois we will rely on factual data and we will lead with the science. That and the goodwill of the people of Illinois will be what sees us through this pandemic.